PSY 307. Study Section 6. Mental Retardation. Introduction. In this lecture, our focus is on mental retardation. We shall examine the basic definition according to the DSM-IVTR, the common characteristics accompanied with mental retardation, the levels involved in mental retardation, and finally, the major etiology of mental retardation. Objectives. At the end of this lecture, you should be able to 1. Define and explain what mental retardation is. 2. Outline and explain the causes and levels of mental retardation. And 3. Explain the etiology of mental retardation. Content. Mental retardation is categorized by DSM-IVTR as one of the disorders usually first diagnosed in infancy, childhood, or adolescence. It is not considered a cognitive disorder, but affects cognitive functioning. The definition of DSM-IVTR includes the following criteria. 1. Significant sub-average intellectual functioning, ordinarily interpreted as an IQ score of 70 or less on an individually administered IQ test. 2. Concurrent deficiencies in adapting behavior, social and daily living skills, degree of independence lower than would be expected by age or cultural group. 3. Onset before age 18, sub-average intellectual functioning arising after age 18 is typically categorized as dementia. Common characteristics that accompany mental retardation are dependency, passivity, low self-esteem, low tolerance of frustration, depression, and self-injurious behavior. APA 2000. Relative to the general population, persons with mental retardation are much more likely to suffer from psychiatric problems. The more severe levels of mental retardation are associated with speech difficulties, neurological disorders, cerebral palsy, and vision and hearing problems. Individuals with autism may also exhibit cognitive deficits, but mental retardation has been distinguished from autism or various mental and perceptual attacks. Levels of retardation. DSM-IVTR specifies 4 different levels of mental retardation, which are based only on IQ scores ranges, as measured on the revised Wechsler scales. 1. Mild IQ scores, 50 to 55 to 70. 2. Moderate IQ scores, 35 to 40 to 50 to 55. 3. Severe IQ scores, 20 to 25 to 35 to 40. And profound IQ scores, below 20 or 25. Social and vocational skills and degree of adaptability may vary greatly within each category. It should be noted that the American Association on Mental Retardation, AAMR, unlike the American Psychiatric Association and DSM-IVTR, does not use a classification of mental retardation based on levels of intellectual functioning as reviewed in IQ scores. Instead, AAMR considers limitation in both the intellectual and adaptive skills of the individual. Adaptive skills include those required in communication, self-care, social interactions, health and safety, work and leisure. Furthermore, The skills are placed in the context of one's culture and community. Mental retardation is diagnosed only if low intelligence is accompanied by impaired adaptive functioning. Low intelligence alone, or deficits in adaptive behavior alone, does not result in a diagnosis of mental retardation, according to AAMR. Although the DSM-IVTR and AAMR use intellectual and adaptive functioning as criteria in the diagnosis of mental retardation, AAMR focuses more on adaptive functioning, and it specifies the type and nature of psychological support needed in adaptive functioning. Produced by environmental factors such as poor living conditions, biological factors, or some combination of the two. The etiology is dependent to some extent on the level of mental retardation. Mild retardation is generally idiopathic, having no known cause, and familiar, whereas severe retardation is typically related to genetic factors or to brain damage. Environmental factors. Certain features of the environment may contribute to retardation. Among these are the absence of stimulating factors or situations, a lack of attention and reinforcement from parents or significant others, and chronic stress and frustration. In addition, poverty, lack of adequate health care, poor nutrition, and inadequate education place children at a disadvantage. A lower social economic status generally implies a lower mean group IQ scores. Individuals will fall in the upper range and some in the lower. Researchers have suggested that the normal range of intelligence lies between the IQ scores of 50 and 150, and that some individuals simply lie on the lower end of this normal range. No organic or psychological anomaly associated with mental retardation is usually found in this type of retardation. Most people classified with mild retardation have normal health, appearance, and physical abilities. On mental chromosome. Although impairment in functioning varies among those with inherited forms of mental retardation, many affected persons have severe deficits. Those with profound retardation, about 1 to 2% of those with the disorder, may be so intellectually deficient that they require constant and total care and supervision. Many also have significant sensory motor impairment and are confined to a bed or wheelchair by the congenital defect that produced the retardation. Even with teaching, there is minimal, if any, acquisition of self-help skills among these individuals. Their mortality rate during childhood is extremely high, with more than 1.5 dying before age 20. Associated physical problems such as neuromuscular disorders, impairment of vision or hearing, and seizures may coexist. Down syndrome is a condition produced by the presence of an extra chromosome, trisomy 21, an autosomal or non-sex chromosome, and resulting in mental retardation and distinctive physical characteristics. Down syndrome is an example of chromosal disorder. It may occur as often as once in every 1,000 live births. About 10% of children with severe or moderate retardation show the genetic anomaly. The well-known physical characteristics of Down syndrome are short incurving fingers, short broad hands, slanted eyes, furrowed protruding tongue, flat and broad face, harsh voice, and incomplete or delayed sexual development. Some Down syndrome children receive cosmetic surgery to make their physical appearance more clearly and to eat more normally. The procedure is intended to enable Down syndrome people to fit in as much as possible with their peers to enhance their social interactions and communication abilities. People with Down syndrome who live past age 40 are at high risk for developing Alzheimer's disease. This is because the gene responsible for the amyloid plaques and neurofibrillary tangles found in Alzheimer's disease is located on chromosome 21, indicating a possible relationship between Down syndrome and Alzheimer's disease. People who have Down syndrome show a greater intellectual decline after the age of 35 than do other individuals with mental retardation. Congenital heart abnormalities are also common in people with surgical procedures, have improved the possibility of surviving these heart defects, and have resulted in both a longer life expectancy and a healthier life. Parental detection of Down syndrome is possible through amniocentesis, a screening procedure in which a hollow needle is inserted through the pregnant woman's abdominal wall and the amniotic fluid is withdrawn from the fetal sac. This procedure is performed during the 14th or 15th week of pregnancy. The fetal cells from the fluid are cultivated and within 3 weeks can be tested to determine whether Down syndrome is present. This procedure involves some risk for both mother and fetus, so it is employed only when the chance of finding Down syndrome is high, as for example, with women older than age 35. Remember, however, that the greater percentage of babies with Down syndrome is born to younger mothers, and yet testing for Down syndrome through amniocentesis occurs primarily among older women. A procedure that allows earlier detection of Down syndrome is chorionic villus sampling. Tests are made of cells on the hair-like projections, villi, on the sac that surrounds the fetus and can be performed after the 9th week of pregnancy. Other less common genetical anomalies such as Turner syndrome, Klinefelter syndrome, phenylketonuria syndrome (PKU), Tay-Sachs disease, and cretinism can also produce mental retardation. Non-genetic biological factors. Mental retardation may be caused by a variety of environmental mishaps during the prenatal, from the conception to birth, prenatal, during the birth process, or postnatal after birth period. Prenatal period. During the prenatal period, the developing organism is susceptible to viruses and infections such as German measles, drugs, radiation, poor nutrition, and other non-genetic influences. Increasing attention is being focused on the problem of mental deficits related to alcoholic consumption during pregnancy. Some children born to alcoholic mothers have fetal alcoholic syndrome (FAS), a group of congenital physical and mental defects including small body size and microcephaly and anomaly, whose most distinguishing feature is an unusual small brain. Such children are generally mildly retarded, but many are either moderately retarded or of average intelligence. Those with normal intelligence seem to have significant academic and intentional difficulties. However, as well as a history of hyperactivity and behavioral deficits. Smoking and poor nutrition may increase the likelihood that as alcoholic mother we have FAS offspring. Available information suggests that one case of FAS occurs in each 750 live births, which places alcohol among the most common causes of retardation, for which an etiology can be determined. Among the different ethnic groups in the United States, the rate of FAS is especially high among American Indians. Prenatal period. During the prenatal period, mental retardation can result from birth trauma, prematurity, or asphyxiation. After birth or during the postnatal period, head injuries, infections, tumors, malnutrition, and ingesting toxic substance such as lead can cause brain damage and consequent mental retardation. Compared with prenatal factors, however, these hazards account for only a small proportion of organically caused mental retardation. The most common birth condition associated with mental retardation is prematurity and low birth weight. Although most premature infants develop normally, approximately 20% show signs of neurological problems reflected in learning disabilities and mental retardation. In a study of more than 53,000 U.S. women and their children, researchers found that low birth weights were generally associated with low IQ scores. The average IQ score of children who had birth weights between 26 ounces and 52.5 ounces was 86, whereas those with birth weights between 122 ounces and 140 ounces had an average IQ score of 105. Postnatal period. Although most types of mental retardation now have decreasing incidence rates, mental retardation owing to postnatal causes is on the increase. For example, direct trauma to the head produces hemorrhaging and tearing of the brain tissue, often as the result of an injury sustained in an automobile accident or from child abuse. Depending on the definition of child abuse, estimates of the number of the cases of child abuse per year range from 35,000 to 1.9 million. Of this group, large percentages are subjected to violent abuse that could cause serious injury. Other postnatal causes include brain infections, neurological diseases, toxic exposure, and even extreme malnutrition. Summary. In this lecture, we have discussed what mental retardation is and the likely causes. Specifically, we comprehensively examined the etiology of mental retardation, though environmental factors, genetic factors, and non-genetic factors. Finally, we looked into the various patterns of non-genetic factors, such as prenatal and postnatal. End of study session 6. Thank you for listening.